Hello everyone, and thank you for joining us. You may have heard that this week is National EMS Week, a time when we recognize emergency medical workers in our community. Here at the Grand Junction Fire Department, I'm honored to work with the best. Our crews dedicate their lives to this work, and medical services make up over 80% of our calls. They train to keep their skills sharp, respond with compassion and care to try and make a difference on every call, no matter how big or small. They and their families make sacrifices for this lifestyle of serving our community. It's an honor to work with the emergency medical professionals of the Grand Junction Fire Department.
Under normal circumstances, we would be celebrating our Phoenix Awards in person. While maintaining our social distance requirements, we want to acknowledge all providers who participated in life-saving events. These awards recognize EMS professionals, law enforcement, and dispatchers who respond to cardiac emergencies. What makes these awards special is the outcome. These are for patients who survived a cardiac arrest with no medical deficits, which is a rare thing indeed. As you will see in a moment, these are unique medical emergencies that take a whole team to provide care. The survival of a cardiac arrest depends on early notification of 911, trained dispatchers to coach citizens through CPR, citizens willing to provide hands-only CPR, law enforcement officers who are often first to arrive on scene and provide and continue care, our EMS personnel, often in crews of 6, providing efficient and effective care, and of course, hospital medical teams to continue the care and recovery of the patient. Today, we want to share 7 stories of survival from 2019 and recognize our crew members involved in life-saving efforts of the patients.
On January 24th, a 69-year-old male suddenly collapsed in his home. Someone in the home saw him collapse and began giving hands-only CPR, a critical life-saving effort when a heart suddenly stops during cardiac arrest. Law enforcement officer arrived and took over CPR until Grand Junction Fire Department crews arrived. Grand Junction Fire Department crews took over CPR, assessed the patient, and provided an electrical shock to the heart using a defibrillator. During the transport, the patient lost pulse and CPR was resumed. After reestablishing breathing and a pulse, the patient was intubated and turned over to crews at St. Mary's Hospital. The crews that are receiving awards for this patient is Brandon Hildebrandt, Mark McIntyre, Billy Reyes, Mike Cox, Blake Heim, and Matthew Bolig.
On March 6, 2019, a wife heard a commotion in the hallway of her home and found her 82-year-old husband unresponsive on the floor. With directions over the phone from dispatch, the wife began CPR within 2 minutes of her husband collapsing. When a law enforcement officer arrived on scene, he noted the patient was breathing ineffectively and continued hands-only CPR until Grand Junction Fire Department crews arrived. After defibrillating the patient and administering medication, his pulse returned and he was transported to St. Mary's Hospital. The Grand Junction Fire Department crew receiving awards are Jacob Long, Michael Zeke, Eric Moyer, David Bain, Brian Clark, and Jody Hudson.
On July 6, 2019, a roommate was helping his friend into bed when the 58-year-old male suddenly stopped breathing. After calling 911, the roommate followed dispatch instructions, moved the patient to the floor, and began hands-only CPR with instructions from the dispatcher. An officer continued CPR until Grand Junction Fire Department crews arrived. A heart monitor was placed on the patient and crews provided CPR, intubation, mechanical ventilation, and medications for 15 minutes before a cardiac arrhythm was reestablished. The patient was transported to St. Mary's Hospital. The crews that were involved with the success of this patient was Cade Knight, Nick Stanko, Tyler Glassman, Matt Martins, Scott Myers, and Derek Scholand.
On July 29, 2019, a 35-year-old woman collapsed in a grocery store. An off-duty nurse witnessed a cardiac arrest, called 911, and along with the woman's husband provided CPR. When officers arrived on scene, they aided in continuing CPR. Grand Junction Fire Department crews assessed the patient, continued CPR with defibrillation, suction to clear the airway, ventilation via a bag valve mask, and administered medication until a cardiac rhythm was reestablished. The woman was then transported to St. Mary's Hospital and care was transferred to the emergency room medical team. The Grand Junction Fire Department crew receiving the awards for this call are Ginger Oviatt, Joshua Robinson, Derek Scholand, Justin Dillon, Scott Myers, and Logan Piccolo.
On September 14th, 2019, a 79-year-old male began having chest pains in his home. While our crews were on their way, he became unresponsive. Family members attempted to move the man from the couch to the floor to provide CPR, but were unable to move the patient. By the time the crews arrived, the patient had been unresponsive for 2 to 3 minutes. Crews moved the patient, provided CPR, 3 rounds of defibrillation and medications, and finally an intubation. After 20 minutes of care, a cardiac rhythm was reestablished and the patient was transferred to St. Mary's Hospital. The crews receiving the award for helping save this patient's life are Zach Lyda, Billy Reyes, Jerome Gardner, Sean Turley, Brian Clark, and Ada Shilcox.
On November 23, 2019, a 76-year-old male was returning home when he collapsed in his driveway. His son found him unresponsive with abnormal breathing. His son and another person moved the man into the house, called 911, and began CPR with instructions from dispatch. Grand Junction Fire Department crews arrived on scene to find that a law enforcement officer had taken over CPR. Grand Junction Fire crews evaluated the patient and provided care with several rounds of pit crew CPR, medication, and an intubation for 30 minutes before a pulse was reestablished. The patient was transported to St. Mary's Hospital, and on the way, his heart stopped again. Crews resumed CPR for the rest of the transport and transferred care of the patient to the emergency department medical team. The Grand Junction Fire Department crew receiving awards for this call are Patrick Dipsey, Kenyon Hendricks, Jed Redden, Nick Stanko, Brian Kretschmann, and Brian Lurvey.
Three days before Christmas, on December 22nd, 2019, a husband found his wife unresponsive in bed and breathing abnormally. He immediately called 911 and, with instructions from dispatch, moved his wife to the floor and began CPR. When crews arrived, the husband told him that his wife had been experiencing difficulty breathing prior to the cardiac arrest. Crews continued to provide care with CPR, attempted intubation, providing ventilation with a bag valve mask, and medications. When a cardiac rhythm was restored, crews transported the still unconscious patient and turned the patient over to the care of St. Mary's Hospital. The Grand Junction Fire Department crews that was involved in saving this patient's life and receiving the award is Kirk Hallam, Sean Turley, Brian Lurvey, Daniel Jenkins, Josh Evans, and Josh Sparks.
Pretty amazing. 7 different individuals are alive and well thanks to the efforts of our emergency medical technicians, paramedics, firefighters, dispatchers, and law enforcement partners. Today you heard over 30 names read, close to 40 names read. Actually, a couple people were read 2 or 3 different times because of the calls that they were on multiple times. And so we just want to honor those folks in our department and for all the work they've done to make a difference in these lives. We'll keep this video on our page for the patients, families, crews, and other first responders involved in these life-saving efforts. And I want you to remember that in these emergencies, we also depend on citizens to provide good CPR. We provide free, hands-only CPR training in the community so that you too can be prepared to save a life. We want to thank you for helping us honor our emergency medical professionals this week. And please, let's be careful out there and stay well and healthy. Thank you.